The vitamin D paradox that was never fixed for decades. The public received the same guidance: 600 IU of vitamin D per day would be sufficient. That number became standard in medical offices, supplement labels, and official guidelines, repeated as if it were unquestionable truth. The problem is that it never reflected the real biological needs of most people, and even after being exposed, it was never corrected. This was not a technical detail or outdated science. It was a structural failure of the system. Today, vitamin D deficiency is neither rare nor isolated. It is global. Millions of people live with persistent symptoms without ever connecting them to vitamin D, because they were taught to believe they are already getting enough. They are not. Chronic fatigue, weakened immunity, muscle pain, low mood, difficulty concentrating, metabolic disturbances, and resistance to weight loss have become common. The body sends signals, but the cause goes unnoticed. When official recommendations were created, data were not analyzed at the individual level. Population averages were used. That is the core error. Averages assume everyone absorbs, metabolizes, and uses vitamin D the same way. They ignore age, body fat, inflammation, genetics, sun exposure, and lifestyle. Biologically, that makes no sense. It is like averaging exam scores from multiple classrooms and concluding that all students passed, even when half of them failed. Years later, researchers reanalyzed the exact same data used to define the official recommendations. The result was clear: the dose required for most people to reach adequate vitamin D levels was not 600 IU. It was close to 9,000 IU per day. This was not opinion. It was mathematics. Other independent studies confirmed this reanalysis. Even so, nothing changed. When an error of this magnitude is identified, only two paths exist. Either the system corrects itself, or the system protects itself. To understand why vitamin D guidelines were never adjusted, it is necessary to understand how certain institutions operate. Some are presented as impartial scientific authorities, but in practice their function is not to challenge the system. It is to stabilize it. They do not ask, what is true? They ask, what is defensible? History shows this pattern repeatedly. Harmful substances treated as safe for decades. Evidence postponed under the constant claim that more studies are needed. Problems delayed until time dissolves responsibility. With vitamin D, the same playbook was followed. If the low recommendation were merely a technical mistake, correcting it would have been simple: update the numbers and move on. Instead, the low dose has been defended even more rigidly, despite the mathematical error being demonstrated and despite the worldwide rise in deficiency. This indicates the discussion is no longer scientific. It is institutional. Where incentives exist, consensus replaces truth. Vitamin D is not just a bone-related vitamin. It functions as a hormonal regulator and directly influences immunity, muscle strength, brain function, mood, memory, glucose control, inflammation, and the risk of multiple chronic diseases. Deficiency does not appear dramatically. It erodes health slowly. People do not feel deficient. They feel tired, mentally foggy, inflamed, unmotivated, and stuck. And they are often told everything is normal. There is a simple question that exposes the inconsistency of current recommendations: how much sun exposure produces 600 IU of vitamin D? Approximately 3 minutes. The human body was not designed to function on 3 minutes of sunlight per day. For most of human history, sun exposure naturally generated thousands of units daily. When sunlight hits the skin, cholesterol is converted into vitamin D, which enters the bloodstream and must then be activated inside cells. And here is a crucial point: blood levels do not necessarily reflect what is available inside cells. That is where deficiency hides. Many guidelines state that 20 nanograms per milliliter of vitamin D is sufficient. But sufficient for what? Preventing rickets, perhaps. Supporting immunity, metabolism, and brain function? Likely not. While there is no absolute consensus, many professionals consider levels between 50 and 80 nanograms per milliliter more compatible with adequate cellular function, especially in individuals with obesity, diabetes, fatty liver, autoimmune diseases, or chronic inflammation. Whenever vitamin D is discussed, fear of toxicity is used to shut down the conversation. But toxicity events are extremely rare and typically require very high doses over long periods. Even then, the issue is not vitamin D itself, but calcium imbalance, and that is preventable. Vitamin D does not act alone. Magnesium is essential for its activation. Without magnesium, it does not function properly. Vitamin K2 helps direct calcium into bones, preventing accumulation in the bloodstream. Adequate hydration protects the kidneys. These factors dramatically reduce risk, yet they are rarely explained. The real public health problem is not excess vitamin D. It is deficiency. And it affects most of the world's population. Why deficiency became the norm and what actually works. Vitamin D deficiency did not become widespread by accident. It is the predictable result of how modern life is structured. Humans evolved outdoors, exposed to sunlight daily, moving their bodies, regulating hormones naturally through light-dark cycles. Modern society reversed that environment in a single generation. Most people spend the majority of their lives indoors. Offices, schools, cars, gyms, shopping centers. When they do go outside, they are covered with clothing or sunscreen. At the same time, chronic inflammation has become the biological background of modern life. High sugar intake, ultra-processed foods, poor sleep, stress, obesity, and metabolic dysfunction all reduce the body's ability to activate and use vitamin D efficiently. So even when someone supplements or gets occasional sun exposure, the body may not respond normally. This is what many people experience as vitamin D resistance. The problem is not only intake. It is utilization. Body fat plays a major role. Vitamin D is fat-soluble, meaning it gets sequestered in fat tissue. In people with higher body fat, less vitamin D remains available in circulation and inside cells. Inflammation further blocks vitamin D receptor activity. This creates a situation where blood levels may look acceptable, but cellular function remains impaired. This is why many people supplement for years without meaningful improvement in symptoms. The strategy is incomplete. Another major misconception is relying solely on blood tests as proof of adequacy. Blood vitamin D reflects what is circulating, not necessarily what is being activated and used inside tissues. Two people can have the same blood level and completely different biological responses. One feels energized and stable. The other remains fatigued, inflamed, and cognitively foggy. This is also why blanket recommendations fail. Biology is context-dependent. A sedentary indoor lifestyle with chronic inflammation requires a different approach than a physically active outdoor lifestyle. Treating everyone the same guarantees suboptimal outcomes for most people. Addressing vitamin D properly means addressing the environment in which it must function. Sunlight still matters. Short, regular exposure is biologically meaningful, especially when large skin areas are exposed without burning. Seasonal changes matter too. Winter months dramatically reduce natural vitamin D synthesis, even in sunny regions. Latitude, skin pigmentation, age, and time of day all influence production. Supplementation becomes necessary for most adults, not as an extreme intervention, but as a correction to a mismatched environment. The goal is not megadosing. The goal is restoring physiological sufficiency. Equally important is what accompanies vitamin D, and magnesium is non-negotiable. Every step of vitamin D activation requires magnesium. Without it, vitamin D remains largely inactive. Many people are magnesium deficient due to poor intake, stress, and high sugar consumption. Correcting vitamin D without magnesium often leads to disappointing results. Vitamin K2 plays a protective role by guiding calcium toward bones and away from soft tissues. This is especially relevant when vitamin D intake increases. Hydration supports kidney function and mineral balance. These elements work together. Ignoring one weakens the entire system. Fear around vitamin D toxicity often distracts from this integrated perspective. Toxicity is not a realistic concern for the vast majority of people using reasonable daily doses. It becomes relevant only with prolonged excessive intake without cofactors or monitoring. Meanwhile, deficiency continues to damage health silently. The practical approach is not complicated, but it must be coherent. Regular sun exposure when possible. Consistent vitamin D intake adjusted to individual needs. Adequate magnesium intake. Inclusion of vitamin K2. Attention to sleep, inflammation, and metabolic health. These factors amplify each other. Vitamin D should not be treated as a standalone pill. It is part of a biological system that responds to lifestyle, nutrients, and environment. When that system is supported, vitamin D works remarkably well. When it is ignored, supplementation alone produces limited results. The real failure was never about a single number. It was about ignoring human biology in favor of simplistic averages. Once that is understood, the confusion around vitamin D disappears. This is not about rebellion against science. It is about applying science correctly, at the level of human physiology, not institutional convenience. Understanding vitamin D is ultimately about understanding how modern life disrupts ancient biology. When that gap is addressed, many symptoms people consider normal aging or unexplained begin to make sense and become correctable. If this video helped you understand how vitamin D actually works in the body, like the video, share it with someone who cares about their health, and subscribe to the channel. Here, the goal is to help you recognize how the body functions before small imbalances turn into real problems.